Hey, thank you for joining us today on even if you're watching on YouTube or Facebook. Please feel free to comment and leave your questions, leave your praises to our guest today. Our guest, he is currently serving as an advisor to the American Heart Association in South Florida. He is an elder in the Tabernacle SDA Church here in Miami, and as a member of the executive committee of the North American Division of Seventh-day Adventists. He's involved there as well. Dr. Carrington has received many awards. He is a father and a grandfather. It fills his heart. And if we're to get into all his accolades, we might not be able to get to his true purpose for joining us today, which is to educate us on COVID-19, vaccines, etc. So as he presents, make sure to take notes and have with you a few questions that you might want to ask Dr. Carrington towards the end. But without further ado, please, Dr. Carrington, welcome here to Miami Temple. Thank you for taking the time to really be a teacher to us during a moment of distress that we're living in our country and through this pandemic. So thank you. Thank you for being here.
Thank you so much, Brian. It's so good to be with you this afternoon, Pastor Brian. It's really, really great. I really appreciate the opportunity. I want to thank your staff and the committees that are responsible for getting me here. I hope and pray that you will indeed learn some things about this COVID crisis, and hopefully we'll be able to help each other to understand what's going on and to live healthier lives and protect ourselves from some of the challenges that we face. I'd like to say, I'd like to say a special shout out to Judy McCullough, Dr. Judy McCullough. She's a good friend, and I'm really, really happy to be able to work with her also.
Yes. Judy, she's the one who, Dr. McCullough, she's the one who really pushed for you being here. We say a big thank you to her and to the Ministry of Health here at our church. And, I was wondering how it is that she knows you, but then I saw in your bio that you also went to UM for some time.
Oh, yeah, yes. That's where I did my internship and residency and fellowship, etc. And I was able to meet her and her husband when I got to Miami. And that's how we became friends, both of us.
Awesome. Yeah. Awesome. Well, let's have a quick word of prayer, and then the time is yours, Doc.
Okay.
Heavenly Father, Lord, as we enter into this conversation, as we create this space for knowledge to be shared and to be learned, may you continue to inspire and uplift your servant, Dr. Carrington, as he shares some insight with us and helps us to live more wholesome lives. We thank you for his ministry and for the opportunity to be learning here today. In Jesus' name we pray. Amen. Dr. Carrington, the time is yours.
Thank you so much.
It's all right. You might you just have to mute one of your inputs.
Yeah, we're good.
And lower the volume on the other.
Yeah. Right, we're getting some input background here, so
you got it.
That's better.
All right, yeah, all yours.
Yes, StreamYard is a little bit new, so we're working with it. Yes. Okay. This evening, as we said, we're going to be talking a little bit about COVID-19, and I entitled the topic "The Bad, the Good, and the Ugly," because of all the hoopla that we've been hearing in social media and from other sources. And I wanted to make sure that we get a clear understanding as to what is happening here and what we need to do about it. So the objectives for this evening are: one, we're going to try to explain a little bit about the nature of SARS-CoV-2 and the disease that it causes. Explain how the immune system functions, because that's a critical feature in understanding what we do, why we do, or why we do what we do. Then we are going to look at a historical need for vaccines, why people make them, why they have become so popular in the last half century to a century. And then explain a little bit about the development of COVID-19 vaccines, and then discuss the need for those vaccines in our culture today. So As many of us know, COVID-19 is caused by the virus SARS-CoV-2, leading to a broad spectrum of respiratory syndromes, from just mild upper respiratory tract infections to severe pneumonia, which indeed can be life-ending. Even though pneumonia is the most common cause of death because of this particular disease, it also leads to a myriad of other complicating uh, diseases. COVID-19 is a very ugly syndrome leading to significant morbidity and mortality. People can get heart attacks, strokes, develop arthritis, kidney disorders, liver disorders, intestinal disorders. The syndrome just encompasses almost every system in the body. And as a consequence, that's why folk are so scared about contracting this disease, especially if it becomes severe disease. So we definitely need to take a look at this disorder and do something about it. As you know, the first occurrences happened sometime last December of 2019, as a matter of fact, and then it came to America in January of 2020, and we saw the first cases occurring in the state of Washington, and those cases subsequently multiplied dramatically, with New York being like the epicenter or the hub of where all these diseases started to occur. And with it, a lot of challenges were developed in our country. We had to face a lot of different challenges. The disease itself, as I said, was a pretty mild disease initially in some people, but in others it turned out to be a devastating disease. We've seen the death and destruction and devastation that has resulted from it. And as a consequence, we have become concerned. The disease has spread across the world quite rapidly, becoming one of the largest pandemics we've had in 100 years. And this challenge has been one that has caused nations and governments around the world to try to get a focus or a hold on what to do and how we can control this disease to make life for people to be better. As you know, we have been under lockdowns. Even in the island that I'm from, Barbados in the Caribbean, we're still under a lockdown there to a large degree. We've had to wear face masks. We've had to practice social distancing. We've had to stay in isolation from certain people. I've had friends whose parents have died and they couldn't even go to the bedside with their mums or dads as a consequence of this disease. It's been a horrific thing that has been happening in this country and around the world. And that's why COVID-19 is taking the center stage in our civilization today. In almost every country you go in the world, this has become a significant problem for the nations. I know that some islands of the South Pacific, because they happen to be on the North American Division Committee, and some of those islands, they don't even allow tourists to come there anymore because they don't have the infrastructure to support COVID disease. So as a consequence, the majority of those countries are closed down. And there was one missionary on one of the stations who, when I last heard, he had been away from his wife because he got stranded on one of the islands, and he couldn't even get back to see his wife because there's no inland out to go back home, basically. So as we alluded there, the challenges we face with this disease are significant. The disease is a deadly disease, causing death at about a 1% rate in our population. And as you know, hundreds of thousands of people have died in the United States and around the world. The statistics are quite alarming. People are still continuing to die, and we are still concerned about this. Usually it affects the elderly more than it affects younger people, but it is thereby it's a challenge to these populations. Furthermore, the disease is very easily transmitted, and that's one of the scary things about it. That's why we have to take all these protections against it, because of the efficiency in transmission that happens when a person is exposed to the disease. My son and his girlfriend, they have already had the disease. They went out on a trip, and when they got back, they were COVID positive, and they had to be isolated for a couple of weeks until they became negative and before they could come back to the house. So if you have kids out there, make sure that if your kids are not behaving well and they're taking trips that they should not be taking, make sure that they get tested before they come in the house, because they come in the house and expose you to it, and it's very, very easy for you to catch the disease, as it were. And then there's the challenge of the variants that we have. There are many variants of this disease, and that are popping up. At least there are 3 or 4 now, and we are hoping that they don't emerge in a way that they'll be resistant to treatments. Because if this happens, obviously it will be an even greater challenge in controlling this disease and helping people to live healthy in this COVID environment. So we want to make sure that this particular phenomena is not happening in our communities, and we want to stay away from these variants as much as possible. Next, I want to talk to you a little bit about what the virus actually looks like, and why we do what. This will get us into why we do what we do. This is a pictograph, basically, of what the viral structure. Basically, it is what we call an icosahedral kind of virus. It has an inner core where the messenger RNA is located, and then it also has this outer coat, or the envelope protein, and the membrane proteins on which the spikes are present. These spikes are what cause attachment to the respiratory epithelium of human beings. If the virus goes on your skin, it's not going to attach. If it goes to your fingernails, it's not going to attach. But when it gets into your nose and it gets to the respiratory epithelium, there's certain receptors there that bind this quite easily, and as a consequence, we are able to get the disease. So the spikes have to be attached to respiratory epithelium in order for a person to get the disease. As a consequence, we are focusing on technology to block this attachment, and that's how vaccines have a role to share. Basically, they are able to stop this attachment process, and hopefully in doing so, a person will not become infected. And this is where the majority of the research in coping with COVID is being directed. We want to not allow this phenomenon to happen, and this is one of the easier ways to stop transmission of disease. If you can block something from getting to where it's supposed to be going, then you can hopefully avoid the disease altogether. Obviously, there are other processes that go on when a virus attaches to a cell and it gets its DNA or RNA into the cell that is attached to, and there are also medications that can help stop those for other viruses. So far, we haven't really exhausted or researched those mechanisms in this particular virus yet, but probably down the line, those will become other options in treating disease. For many of the other viral syndromes, there are medications that block not only attachment, but block the ability of the virus to expel its genetic material into the host cell, and also to stop the replication processes. A lot of those things are done in the treatment of HIV. where we have the antiretroviral therapies from different medications to block the attachment processes. So those haven't been done so far for COVID, but I wouldn't doubt that in the future that will be one of the treatment options that will be going on, because as you know, if a variant pops up that we can't stop the attachment, then we have to block it at some other source. So scientists will be looking for other ways that they can prevent the infection from developing. So I look at the statistics recently, and there are millions of cases worldwide. I was going to pull them up, but I think everybody in the United States and around the world watches CNN these days. So we know that there are significant deaths worldwide and in the United States, and there have been significant economic losses. People have lost their jobs, lost their houses, lost other forms of resource and income. The unemployment rate in the United States is still around 6%. And last I heard, 9.5 million people still out of work in our country as a result of this disease and what it has caused. It has decimated the tourism industry in the island of Barbados, where I'm from, and even in some other countries that have suffered similar losses. The restaurant industry, where some of my friends have restaurants, that they can't host people the way they used to host them before. And I know in California, many restaurants even had to close because of the challenges that they face. So this causes, in addition to the personal losses in terms of death and illness, and the disability that results from having COVID, then there are also the economic losses, which really put people in a tailspin. So it makes it even more inevitable that we have to find something to stop this disease and to try to help to make it something that we are not fearful of anymore. So I'm going to take a little look at the immune system right now and give you a better understanding of how that works. Obviously, the immune system in our body is a surveillance system that the good Lord made for us, and it looks for any strange or any antigen that pops in that is not self. It's not something that we know as self, and our bodies then creates a response to try to destroy whatever this antigen may be that is popping into our bodies, this unknown substance or bug or bacteria, whatever it may be. And when this happens, a response is mounted to try to destroy it. When a virus is new, unfortunately, and the body has not seen it before, and we don't have any memory for it, mounting that immune response may take a little longer. It may not be as vigorous as we would like, and sometimes people die before their bodies are able to generate the needed immune response to kill the bug that's in their body. And this is a huge problem with COVID, especially in older people. They are not able to meet this immune response, and as a consequence, the disease is not able to be overcome by the body, and so they die. And young children and younger adults, like my son, nothing much happens. My son said that the only symptoms he had from the disease when it started was he couldn't smell things as good as he used to before, but his sense of smell has already come back, and he's able to enjoy the smell of good food. We're Caribbean people, so we like eating good food. And so he's back to normal from that point of view. However, I should say that some people develop other symptoms that are not so easy to come back. A lot of people have other symptoms that result and stay for a long time, and some so far haven't even resolved in some people yet. So that's the problem that we have to look for. Anyhow, I want to go back here to the immune response and show you here what it looks like. This is a graph that one of my good doctor friends sent loaned to me here, and this is the immune response for a typical person who is recovering from SARS-CoV-2, and you can see the red line, which shows how a person may contract the virus, how the viral load may rise in the person's body, and then how it is subsequently is corrected, or as the virus, the antigen is destroyed, the viral titers become lower and lower. And you can see the typical antibody responses here. In our bodies, we have certain substances that will attack the antigen or the virus and basically try to destroy it. And there are basically three main antibodies that may be involved in this process: IgG, IgM, IgA. IgM is the one that usually comes out the first, and that will tell you if the person has an acute infection. IgG comes out a little bit later, and the body makes it, and that one lasts the longest. And when they're checking a person's blood to see if they have been exposed to the COVID, that's the particular antibody that they'll be checking for. Also, if they have to give someone serum from or plasma from somebody's blood to help them with to fight off the COVID, this is what they'll be looking for: the level of IgG in that plasma. If it's high enough, then it may help in slowing the course or helping that person to recover if they have enough antibody present in the plasma that's being transfused. So this gives you an idea as to how the body reacts to substances that come into the body, how the immune system responds. And this is specifically for COVID-19. Let's talk a little bit about the history of vaccines. Vaccines are not new. The first vaccine came out centuries ago when we were looking for cures for smallpox. And Dr. Jenner noted that if you give a person the cowpox, that person could recover because of the cross immunity that had formed. And over the years, many people have developed other vaccines, and we have a slew of vaccines now available on the market. So we see that the progress of vaccine development has been accelerated, and there are multiple different types of vaccines on the market today. And obviously the newest technology is the current vaccine that we're looking at, which is the mRNA series of vaccines that are now being developed as a result of improvements in technologies. So these are the things that we utilize to try to build that immunity for people. Now, the former types of vaccines can be divided into two types. One, the whole microbe vaccine, which like polio is a whole microbe vaccine where you use inactivated virus. The virus is basically inactivated, and that is administered to a person. The person can then develop antibodies to that virus and stop it from happening. Some other vaccines use a live attenuated vaccine. Obviously, this is one that you have to be a little bit more cautious of, because if the person isn't able to generate good immune response, they can actually get the disease. So live attenuated vaccines are usually not given to people who have compromised immune systems. And then there is the viral vector vaccine, where a virus can have a vaccine, a genetic material placed in it, and that can be transmitted to another person so that they can have immunity toward it. Usually in this particular instance, the genetic material is sort of made inactivated so that the person really cannot get an infection from the disease. And then there's the subunit kind of vaccine, where certain particles from the vaccine are given to the patient And those subunits that are given are usually ones that are most antigenic. That is, the body finds these particular areas to be the ones that if that the immune system will respond to most aggressively, and hopefully destroy the virus, or create immunity that will help the body to destroy the virus. So, for instance, in the current SARS-CoV vaccine developmental in the development of these vaccines, you can have a subunit, namely the spike protein on the vaccine. You can take that spike protein, put it in a vehicle, basically. We'll talk about that in a little while. And as you put it in that vehicle, you could inject it in the person. That person will still be able to develop immunity without actually having to have the virus, because we know that the part of the virus that is the part that we want to build immunity against is the spike protein. So we can use the spike proteins only, and in that way help to develop a vaccine that will be helpful to people. Obviously, the third type is the mRNA vaccines, and that's what have been developed recently, where we're going to take the genetic material, basically, and have that genetic material placed in a viral vector, meaning it's going to be put inside some kind of mechanism whereby you can have it delivered into the human body. And when it's delivered to the human body, the body can now make the spike proteins or whatever antigen you want to be made. And then when that antigen is made, immunity can be developed to it. I'll go through that process in a little bit more detail for you. Because I know a lot of people have a lot of questions about that particular dynamic. So with the advancement in technology, we have learned a lot about how to do this. So we have now developed this COVID-19 vaccine, or there are many of them, COVID-19 vaccines, that uses particular technology where they can take the messenger RNA, that genetic material that belongs to the virus, that is going to code for the spike protein only, because that's the only thing we really want. That's the antigenic part of the virus. So we want that made. So they identify the sequence in the genome that makes that spike protein only, and allows that sequence to be activated once inside the cell by certain organelles in the cell cytoplasm that can read what the message is on the messenger RNA, make the spike proteins, and then allow the body to develop immunity that way. So you don't have to get the whole virus. You don't have to get an inactivated virus. All you need is the part of that viral RNA or DNA. In the case of COVID, is a messenger RNA, and then you could make the spike protein, the antigen, and basically when that is done, the body can develop immunity from that. So let's look at that a little deeper, so that you can get add into this picture, so you can get a sort of understand of it. First, when the vaccine has to be made, so the vaccine is made with extracting or using recombinant DNA techniques to make that mRNA part of the viral genetic material. Then that mRNA section, as I don't know if you can see closely on the slide, but then that mRNA section is packaged inside an envelope. This is the nanoparticle envelope that you hear so many people probably talking about. and the nanoparticle does not contain 666. I just want to say that right up front. It's made of fatty material and some other chemicals, so that it can bind together and form this house for the messenger RNA to be transmitted into the human body. Now, every time you take a pill, for instance, usually the pill may be in a capsule form or maybe in a tablet form, and it's usually coated with something to make you tolerate the medication easier and to allow it to get into your stomach. There's some pills that if they weren't coated, they would never be of any use to you because they'll be digested immediately in your stomach or destroyed by the acid in your stomach. So you have to have them coated with something so that they can get into your stomach and pass through the stomach, go into the small intestine where they can be absorbed. And this packaging idea is something that obviously that we've learned from nature. Even in the foods that we eat, every fruit that you eat may contain vitamin C, but when you bite a fruit, you don't get pure vitamin C. That vitamin C is packaged in some way inside of the fruit. So you have to digest the fruit so you can get the vitamin C out of the fruit. And the same thing for everything. That's how the good Lord made the world. Everything is packaged in something so that we can get it directly from, or we can get it from the particular moiety in which it is packaged. So the scientists create this package that contains the messenger RNA. That messenger RNA is then injected into the muscles of your arm, basically. That's how the vaccine is administered. I got my shot already. So it's injected into the arm, and the particular cell that is going to get absorbed by basically is the muscle cell, the myocyte, we call them. They're muscle cells. So it is injected into your body, and the muscle cells then absorb this fat moiety. The way how cells are made, all cells have this lipid layer around them. That's how the cell membrane is made up. It's made up of fat, basically, fat and cholesterol. So you have this lipid layer, and as a consequence, the lipid layer that is made by the companies is able to merge with the lipid layer, and in a process of what we call like endocytosis, that merger allows these two moieties to join together, and the messenger RNA can be expelled out of this package into the cytoplasm of the cell. And that being done, there are certain cells in the cytoplasm called ribosomes. If you remember your high school biology, those ribosomes are now able to translate the information from that messenger RNA and help the body to make these spike proteins. Those spike proteins are then expelled to the outside of the cell after the transcription has occurred. They expel to the outside of the cell, and the immune cells, usually a monocyte or a macrophage, or the particular cell type that's there, they're going to grab these cells and then will present them to other sets of cells so that the immune system could know, well, there's a foreign invader in my body and we need to do something to destroy this particular invader. So they're going to work with this so that you can get immunity to the particular antigen, in this case, the spike proteins from the COVID-19 disease or SARS-CoV-2 virus. So with this done, you're able to build an immune response. Now, all the vaccines don't use mRNA directly. There's some who, rather than using the nanoparticle, they use a viral vector. Basically, they get a virus like the cold virus, and they deactivate it. Basically, they insert the DNA from this. They insert in the DNA of this virus the same genetic code material that will code for the RNA. then that particular moiety it comes into the cell, goes into the nucleus of the cell where the messenger RNA is formed. The messenger RNA is then spilled out, and the same process occurs whereby spike proteins can be formed. So these are the ways how the majority of the vaccines are being made today, and the ones that we have here available in the United States are primarily made this way. So the body is now able to make the substances that are potentially harmful to us, and with that, we are able to create immunity against the SARS-CoV-2 vaccine. So next, I want to discuss some of the benefits of the vaccine and some of the risk of taking the vaccine, so that you can get an overview as to take or not to take this vaccine. So these are some of the benefits of the vaccine. One, the vaccine protects from disease, both personally and in the community. As we said before, this disease causes significant havoc in communities and also for our personal lives. Obviously, I was deprived of the company of my son for 2 weeks. That happened at Christmas and New Year's, so we weren't even able to celebrate Christmas together. Perhaps that's a small price to pay. But when people are deprived of loved ones, that's a huge price to pay. And obviously, nobody wants that to happen for anyone else. So we want to protect people from getting COVID-19, and we want to have people to enjoy the best health possible. Furthermore, the community effect is quite widespread, as we've seen in the economic downturn in many countries, and the economic impact that has had on many families. So if we can get this virus under control, and the vaccine can do that, we will be able to benefit from this particular phenomena, basically, that is occurring with the administration of vaccines. Two, the administration of a vaccine reduces antimicrobial resistance by decreasing circulation strains, or sometimes the variants, as we would call them. What I mean by that is, if you give the vaccine to a whole community and the community doesn't get infected with the virus, then the virus doesn't have the opportunity to get into a host cell and multiply or undergo a mutation so that another strain is developed. If only there is one circulating strain and we are able to knock that out, viruses can only multiply and mutate if they're in someone's body. If they're outside of your body, that cannot happen. So the more people who don't get this means that the less new strains will come about, and we'll be able to protect the community a whole lot better. So we want to decrease the amount of circulating strains in the community, and we do that by vaccinating people to reduce that risk of that particular phenomena happening. And now, if you live in a community where so many thousands of millions of people are getting the disease, that means there are millions of viruses, well, billions now then, of viruses circulating in people's bodies, and any one of those could undergo a mutation. But if you reduce that amount, then you will not be allowing these circulating strains to develop. Three, obviously, we can reduce hospitalizations and death. We have seen this. We know that this is possible. We've seen it over the years in many other disease states, and this is a no-brainer. If we can reduce severe disease in people so that they don't have to go to the hospital, if we could reduce their dying, then obviously we're having a big win here for the entire culture. Because when a person goes to the hospital, sometimes, well, you can't even go to see them anymore. This is a big pain and burden on people, and obviously on the nursing staff, etc. So this is a huge benefit for the society if we can reduce hospitalizations and concurrently death rates. Obviously, it reduces healthcare costs. You know that the United States government has spent almost like $10 billion on developing vaccines and for the virus alone, plus all the billions of dollars that you have to spend on healthcare costs for all these folk who were hospitalized from COVID, and all the other ancillary healthcare costs that's related to this disease. So this disease has cost the nation a lot of money, and it has cost the world even more. So if we can reduce the healthcare costs by controlling this disease with a vaccine, then that will be advantageous for us. The risk of taking the vaccine, these are the things that some people don't like, and this is part of the bad, if you want to call it. I said, like, entitled the topic, "The Good, the Bad, and the Ugly." One is that people do get side effects from taking vaccines. I took mine. The only side effect that I had from taking mine was a sore arm for 24 hours. And my dad took his, and my dad had absolutely nothing. He didn't even get a lot of soreness. My cousin took it, and he developed like a flu-like syndrome with the fever, the headache, etc. And he had to be bedridden for, I think, 24 to 48 hours. So those are the common side effects that people get from taking vaccines. That's what you could expect if you take this also. The percentages can range quite high, up to from some of the statistics I saw, up to 50% to 60% of people can get headaches. Okay, some people get nausea. The muscle soreness is like close to about 80%. So these are pretty common side effects that you're going to get. Obviously, they're not dangerous side effects, but they do make life uncomfortable for you for the duration after you've taken the vaccine. Then there are a subgroup of people who develop anaphylaxis. Anaphylaxis is an allergic reaction that one could get from any strange moiety attacking their body. It can happen if you got a bee sting. It can happen if you take a COVID-19 vaccine. So we have to watch for this. It's very rare. Less than 1% of people get this, but we have to still watch for it to make sure that it doesn't happen. Most people now are aware of it after it happened initially from vaccines being administered. So the nurses are on standby to administer medication to reverse the anaphylaxis if it does happen. When I went for my vaccine, I had to wait 20 minutes afterwards so that they could watch me to make sure nothing happened. And this you can get treatment for it acutely to reverse it. I must say that anaphylaxis is something that happens with any medication. I remember when I was doing my internship for medicine, I had to go to the public health department for training to look at community health. And I went there, and one gentleman came in, and he had to get a penicillin shot for syphilis. And the attendant told me to watch the gentleman after he got the shot. Now, I did not know what is going to happen, but I obviously attendant had a lot more experience. And lo and behold, about 10 minutes after the shot, this guy was on the floor shaking, can't breathe, the whole shebang that happens after when this anaphylactic shock reaction sort of develops. So obviously I just had to scream, and I didn't know what I was doing at that time. I was a young rookie, and we gave him the epinephrine and some steroids, and he was back to normal again within 10 minutes. But obviously those are things that you look for, and those are things that experienced medical personnel treat for you. Now, the other bad thing about the vaccine is that we don't know everything about the vaccine that we need to know. Obviously, the vaccines are new. They've just been recently developed, studied for a few months in the experimental groups, but we don't have no 5-year-old studies or 10-year-old studies, because obviously that hasn't been made of it, that among the time hasn't gone by yet. So we can't have studies that long. So as a consequence, we really don't know all the unknowns about the vaccine. Some people have theoretically proposed, and notice I say theoretically, there's no confirmation of this, that People may develop autoimmune diseases from the particles that are injected into a person's body, or if not the particle itself, from the breakdown, the metabolism of those particles into other substances that perhaps that may trigger some autoimmune diseases. But those things have not yet been confirmed. Those things are just projections. So we need time before we can find that out, and that will take years before we get to the end of the story for any vaccine, for that matter, or any medication for that matter. So these are things that we don't know. I know that sometimes you hear on social media that other people claim that they know what's going to happen. As a matter of fact, I'll just tell you a story. A girlfriend of mine called me a couple weeks ago. She had gotten her COVID-19 vaccines, and her ex-husband had called her and told her, you're going to die 3 months after you take this vaccine. Why did you do it? This girl calls me hysterical, frantic. Dr. Karen, am I going to die? Am I going to die? Am I going to die? Now, this gentleman obviously probably had heard some information on the internet that probably said that people would die 3 months after they got the vaccine, and he called her. He had no evidence to support this, but that's what he told the girl. I had to calm her down, and the same thing I'm telling you now, I told her so that she could understand how to cope with the disease. And time has gone by. I can guarantee she's going to die. She's going to die one day, because the Bible says we're all going to die. But I can guarantee it's probably not going to be from COVID vaccine side effects. So I'm going to stop there for the time being, and I'm going to let you ask any questions that you have, so that you can get better information as to what to do about your using this vaccine. And hopefully that you can be able to be informed about what you do. When you take a vaccine, you're going to have to sign an informed consent form. They don't give you a vaccine. You're not forced to take the vaccine. You have to give consent. So, and while you're giving consent, everything is explained to you as to what you need to do. If you don't want to take it, you don't have to take it. It's your call. However, you've seen the risk, you've seen you've seen the benefits, you've seen the potential complications, and obviously, by the grace of God, you have to make that choice. Okay, Pastor B.
Hey, thank you so much for that, Doc. Here, I'm just gonna reaffirm you, right? Because one of the first comments were, the team, is happy that you've joined us, that you've agreed to speak today, and they were really looking forward to this presentation. So without a doubt, we have a couple questions here that I know you spoke a little bit about, but I don't know if you want to add anything to this. So Brandon asked, how long should one wait to get the vaccine after having gotten sick with or testing positive for COVID?
Well, the recommendation is 3 to 4 months subsequently. That you can wait to get the vaccine. I know some people have gotten it even earlier than that, but as I showed you in that graph with the autoimmune response, you could see that up to 3-4 weeks out, you're still having IgG antibody levels, titers there. So you're somewhat protected, but you can boost that protection, because right now we don't know how long that protection will last. That's in all honesty. So there have not been enough long-term studies to show how long that protection will last. So if you want to be absolutely sure, you can take the vaccine 4 months later, 3 to 4 months later, and then you can boost that immune response, so you can be pretty sure of what's going on.
Okay. Yeah. So it's not that the typical time of like they tell you, oh, wait 14 days. No, it's a couple of months that you should.
Yeah,
okay.
I think 14 days is too early, because at 14 days you're still mounting your own natural antibody response to the virus. So you're as long as your body is working well, I can see if you had some other immunocompromising disease that you weren't responding well, you may consider that. But in normal circumstances, I would say no, not at that time.
Okay, thank you. So as people are, engaging with us and getting the courage to put their questions up, Dr. McCullough here writes, people have told me that they don't get the vaccine because they still have to wear masks and socially distance. Can you explain why these precautions are necessary?
Well, even after you've gotten the vaccine, it doesn't mean that a virus circulated in the air can't blow into your nose, and that you yourself cannot cough or spill it out to somebody else. So even though you've gotten the vaccine and the vaccine will protect you, the virus is still alive and well and floating around in the atmosphere if you go in the company of people who don't have it. So you want to reduce the risk of transmission. So we want to reduce the risk of transmission even further. So that's why we wear masks, we socially distance, because we want to retard transmission. As I said, this virus is highly transmissible, very easily transmitted to other people. And so we don't want to do that, even if they have gotten the vaccine. We don't want to put that extra burden on those people. And we don't want those folk who have been vaccinated to pass on to someone who has not been vaccinated yet.
Right.
Yeah, so that's why we do what we do. Yes.
All right, thank you. So, be conscious of the health of others, even if you got vaccinated, of course. Yeah, totally for that. Brandon had another question here. He says, if someone is allergic, right, to the tetanus vaccine, can they get the COVID vaccine? Is that possible?
Yes, they can get the COVID vaccine. The tetanus vaccine is definitely different, totally different from the COVID vaccine. Tetanus is I believe that's an inactivated particle that people get, and that's like more a part of the virus. And it's not packaged the same way that the COVID-19 vaccine is packaged. So the ingredients in the tetanus are totally different from the ingredients in COVID. So they're two different apples and oranges being compared here. So you can still go ahead and do that. And if you are allergic to tetanus, please find another way to get protection, because tetanus is also very dangerous if you get tetanus. My cousin died from tetanus. She developed the whole lockjaw and cerebral symptoms and died in the emergency room because she had been stuck with a rusty image, needle or nail or whatever it was.
Wow.
And she didn't get her booster for the tetanus. And as a consequence, that was a huge problem. Yes.
Get your shots, people. Marlon has a question just to follow up the previous one. We should wear masks, but is there going to be a time where we don't have to? He says, how much time after getting the vaccines can you stop wearing a mask if, the people getting vaccinated have gone to a significant amount and you can say, okay, we have some kind of immunity here?
Well, I agree that a time will come when we will stop stop wearing masks. I want that time to come to myself.
Yes.
I can't predict as to how soon that time will come, because right now, for what I saw, there are only about 10 million people in the United States. I think it was more close to 8 million people in the United States who has even been vaccinated. So we have a long, long way to go before we get at least 200 million people vaccinated in the United States, and that all depends on the economics and the willingness of people to participate. Some people don't want to participate; they want to wait till we get herd immunity, and all those things are going to take a little bit of time. So I can't say when, but I know that they will come.
Yeah, just we have to be patient. We have to be patient.
Yes.
So we hear a lot on the radio and through the news outlets that a certain vaccine is 90%, 98%, 95% effective. So here's where Maurice is coming from. He's asking, when we hear that the vaccine is 99, 95% effective, what makes the vaccine not work in the other 5%?
The way I can't answer directly. Let me let you know how this is done. Okay. Basically, this is done by measuring statistics, right? So they give X amount of patients the vaccine, and they notice that these people contracted the disorder even though they got the vaccine. But they noticed that they were able to protect let's say on average 95 people, but 5 people still got it. In human designing, almost no medicine is perfect. We administer vaccines based on population data and not based on individual data. And if I give you insulin for diabetes, your response to that dose of insulin is going to be different from my response. That's just the way how nature works. We all have different metabolic systems in our bodies that basically work at different rates in different people. So those 5 persons or 5% persons who didn't get it, perhaps they weren't able to mount an immune system response rapidly enough because of some deficiency in their immune systems. Perhaps the dosing was not absorbed properly. There are lots of different kinetics that could be going on to block the best immune response possible. And they've noticed that in some people, when you measure immune responses afterwards, they're not all consistent, like the graph that I showed you before. Everybody doesn't work perfectly. That's just a summary of a particular population, not of an individual. So when we're dosing people for any medication, I'll remember the recommendations come based on population results, not on individual results. So anytime you get a pill, even if it's an aspirin, you should check to make sure that you are responding how you respond, or check your response, because your response may not be the same as the population. So remember that. So when we study when we do the study, we don't look at all the individual metabolic parameters that go on as to why a patient may or may not absorb or respond to this particular treatment the best way possible. So that's why I cannot answer that question 100%. But
right.
That person can, if they know the folk who didn't respond and they want to study them further, then they will have to do that to get an idea as to why this particular response did not happen. Basically.
Yes. Yeah. And I mean, Doc, that makes perfect sense, at least to me, that, we're all unique beings, right? And so our bodies, they're not all the same. So even when it comes to science and medicine, there isn't a cookie cutter response or effectiveness to every single aspect of health. So yeah, I like that.
Yeah, most people tend to believe that the study was done for a particular individual, but no, studies are not done on an individual basis per se. They're done on a population basis. So they're going to recruit 20,000 people to do this study, and then they randomize them, 10,000 to the medication, 10,000 not to the medication, and then they watch and see, and they be able to make statistical predictions. So if it's working in 95% of the people, they'll say, okay, let's go ahead and try it and use it, because that's a pretty good percentage rate. Even if it's working in 70% of the people, like some of the other vaccines were, they say, let's use it because the population as a whole is responding better than nothing. So, or better than placebo, as we would call it. So that's how the data is generated. It doesn't mean that somebody in the 5% could ultimately develop a good immune response later, because their body may just be slow in developing that response. But this is this is what happens when we're basically doing studies.
Right. So Johnson & Johnson just came out with their vaccine, and so Joas is asking, what about the 1-dose version? I'm more interested in getting poked once and be out of there. But there's questions about the efficiency. Is a 1-shot more efficient or less efficient than the 2-shot vaccines that we're seeing from like Moderna and the other one?
Right, so I agree with Josh also to myself. I personally would have preferred the 1-shot vaccine, but unfortunately it wasn't available when I got mine. I got to get 2. So, but remember that the object that we're trying to accomplish here is to block severe disease, try to stop people from going to the hospital, try to stop people from dying. Almost all the vaccines are almost equally efficacious in that level, or in that endpoint. Let's put it that way. So if you took the 1-shot or the 2 shots, you're definitely going to have good protection. Most vaccines only have about 70% protection, some even a little bit less than that. So the having a 90% protection rate is a function of the environment in which that particular vaccine was done. And as I said, it relates to a population and not necessarily to a particular person. So you could do the 1-shot and still be protected just as good as the person who took the 2-shot vaccine.
Yeah. And given what you know right now about the vaccines, is there one that you say you would recommend? Not that we have an option of which one we get, but is there one that you would recommend, Doc?
No, I would recommend any because I think half a loaf is better than no loaf at all. I think what we need what we need right now is protection. So I definitely think that we should be protected. And looking at the side effects and all the other things from all the other vaccines, they're almost pretty much almost on the same par. So the most thing is to get protection, and two, to minimize the side effects as much as possible. So right now, I am not seeing any vaccine that is superior to the other one in the side effect profile, and I think that would probably be the most important thing to do.
Gotcha. There was some worry about this question when the vaccines were first introduced into the public. So, are there any negative effects on pregnant women who take the vaccine? And does research recommend taking the vaccine before or during or after pregnancy?
Well, right now there's no pregnancy data because usually when you're doing, remember the vaccine is out. All the vaccines are out now are only out on an emergency basis. So we have not studied total population. We haven't studied kids under 16. We haven't studied pregnant people. So we can't, generally say that. But for those pregnant women who have volunteered to take the vaccine and have taken it, we have not gotten any reports of adverse effects other than what I've just said in pregnancy. So some pregnant women volunteer to take it, but there's no recommendation for pregnancy per se. You could do it if you want to, and nobody will. Obviously, you sign the appropriate consents, etc., and you do. But there's no government recommendation or CDC recommendation that's going to say all pregnant women must have a vaccine. No, there's nothing like that yet. So if you're pregnant, if you want to take it, you think your immune system is strong enough, and you think you need it because based on the risk that you serve, you work in a hospital and you get exposed to people every day, your risk is very, very high. Then yes, you could go ahead and take the vaccine. If you are pregnant and you're on bed rest at home, you're not going anywhere, you don't really need to take the vaccine. You can wait until after the pregnancy before you do that because your risk is very, very low. So
gotcha. And speaking again to this, when you're vaccinated, you still wear a mask to protect people. I'm assuming, because I'm getting a couple questions here, that even when you get the COVID vaccine, does the vaccine itself reduce the chances of you giving the COVID to someone else?
We don't know that 100% sure yet, but so far it's looking like that. It's looking like if you get the vaccine and you don't harbor the virus, that the virus actually will die when it gets into your body, that the risk of you passing on to somebody else is less. But so far, we don't know 100% for sure that you couldn't pass it on to somebody else. And also remember, when you get the vaccine, you're gonna have to get 2 doses spaced like 4 or 12 weeks apart based on which ones you take. So even though your immune system is rising, it doesn't mean that all the virus in your body is going to be dead that quickly. You got to wait for those viruses to get killed. So you can still pass on live viruses to other people in that phase while the antibody levels are rising to allow your body to be able to kill the virus. This is that you get a shot today and every virus in your body dies the same time. It doesn't work like that. It's a progressive action that's going to be taking place in your body. Gotcha.
And I'm going to start ending it here. If you have some kind of allergy to, let me put this up to see if you understand this question better than I do. If you have an allergy to Reglan, does it contradict, you taking the vaccine, or how would that work?
No, it doesn't. Reglan is a medication that's used for gastroparesis or nausea, the GI symptoms, basically. We use it a lot of patients with diabetic gastroparesis. The moieties that are contained in all the vaccines so far are not related to Reglan. So if you have an allergy to Reglan, it is okay to go ahead and get the vaccine.
Yeah. And if you get, Doc, if you get any vaccine before, treating something else that isn't COVID, and then you go ahead and you get the COVID vaccine, should there be some time that you wait between getting one vaccine and the COVID vaccine, or can you just get it soon after? Does that matter?
Yeah, I would recommend that you wait 2 weeks after, because you don't know what the potential interactions may be. There's some vaccines that can be administered together. Like you get measles, mumps, rubella admitted together. You get tetanus, diphtheria, pertussis admitted together. Those are things that have been studied, but we haven't studied the co-admission of the COVID vaccine with other vaccines yet. So I would take precaution. I will wait, and then I would go ahead and take the other vaccine later, or take the COVID, then take the other vaccines, however you want to do that.
Yeah. So try to wait at least 2 weeks, 14 days before getting your COVID vaccine.
Right.
Awesome.
Mm-hmm.
Well, I mean, I've learned so much. I wish I could get the vaccine now. I can't. I'm not in that age group yet. So blessed are those who are wise in age. And I'm a little jealous.
It's good for you though. It's coming. It's coming.
It's coming. Yes. Lastly, I do want to thank you for this wonderful talk. I've learned so much. Honestly, I had no idea how this stuff worked, and you've really, I feel educated. I feel like I can actually carry a conversation about vaccines, and you've made it sound like something safe and something good for all of us to move forward. The important thing I feel is that even as things are opening up and states are getting rid of the mandate to wear masks, are the safest thing to do for people, for others, and ourselves is to continue to wear masks until otherwise expressed by like a CDC or doctors themselves.
And remember, it is your personal responsibility for your personal health. So you have to protect yourself. Even if the government says eat pork, you know that it's not good for you. You're not going to eat the pork. You have to make sure that you do what's good for you, as revealed by the Spirit of God, the Word of God, and your knowledge of your body yourself. Because, as I said, all these data are population data. They're not personal data. So you have to look at what's good for you when you're doing something. And I would definitely protect myself by wearing a mask.
Love that. Thank you so much, Dr. Carrington. We'll finish this with a quick prayer. Heavenly Father, God, as we have learned more and more about the issues that are going on in our world today, as there's a lot of misinformation going back and forth, we praise you, Lord, because you've brought knowledge to us through Dr. Carrington. And we wish that you continue to bless him, continue to guide him in his ministry, and as he cares and loves for his family. We ask these things, God, in Jesus' name we pray. Amen. Thank you so much, Doctor.
You're welcome.